Hey everyone, welcome to today's Explainer. Today we're diving straight into why protecting maternal and child health is absolutely a team sport. It's a massive misconception that this is just a job for moms and babies. By the end of this session, you're going to see exactly how translating our health knowledge into concrete supportive actions is something literally every single family member can and for sure must participate in. Quick heads up before we jump in, this Explainer is all about empowering you with knowledge. It is for educational purposes only. If anyone in your family is ever experiencing urgent physical symptoms, severe emotional distress, or thoughts of self-harm, please step away right now and get professional medical care immediately. We're here to learn how to support, not to diagnose. All right, here's our roadmap for today. We're going to cover the foundations of family health, early support before pregnancy, active care during pregnancy, critical vigilance after pregnancy, the shared family role, and then wrap it all up with a quick recap. Let's get into it. Starting off with Section 1, Foundations of Family Health. So what exactly do we mean by maternal and child health? Basically, it covers the physical, mental, and social well-being of a mom during and after pregnancy, and children from infancy all the way through those teenage years. The really fascinating part here is how completely intertwined they are. Think of it like a garden. The health of the soil literally determines the health of the seed. A healthy mom directly gives her child a massive head start in life. You simply cannot separate the two. They are a deeply connected system. And this brings us to the absolute core philosophy of today's lesson. We prevent these health issues through bayanihan and malasakit. If you're familiar with these concepts, you know they translate to a deep shared community responsibility and mutual care. It's kind of like a whole neighborhood lifting a house onto their shoulders to move it together. Protecting health isn't some solitary burden that a mother has to carry all by herself. Prevention works best when it's a shared structural scaffolding, where every single person in the family takes on an active role. This timeline right here is based on the World Health Organization's continuum of care. It brilliantly shows that maternal health doesn't just magically start and stop during those 9 months of pregnancy. To truly protect mothers and kids, active family support has to happen across 3 distinct stages: way before pregnancy, during those 9 months, and in the postpartum weeks after. Now, you can't prevent every single bump in the road, but by being consistently supportive across this whole timeline, a family can drastically reduce avoidable risks. Moving on to Section 2, Before Pregnancy, focusing on early support. A really major reproductive health concern in this early pre-pregnancy stage is PCOS, or polycystic ovary syndrome. Medically, it's a hormonal disorder that throws periods completely out of whack. But the social reality, that's where it gets really tough. Because it's not talked about openly enough, a lot of people suffer in complete silence. They deal with limited awareness and frequently face dismissive communication from the people closest to them, which honestly just makes seeking help so much harder and incredibly isolating. So what's our job as family members here? Empathy. Empathy is absolutely crucial. We need to listen without assigning any blame or treating it like some sort of personal failure. We have to create a safe space so they feel supported enough to actually get a professional medical consultation. And then we step up. We support the healthy daily routines their doctor recommends. Maybe it's cooking a specific meal plan together, or just joining them for a daily walk. It is all about shared action. Next up, Section 3, During Pregnancy, focusing on active care. During those crucial 9 months, there are 3 specific concerns where family teamwork is just absolutely vital. First up is anemia. That's when the body is lacking healthy red blood cells. The family can step right into the kitchen and proactively prep iron-rich meals. Second is gestational diabetes mellitus, where blood sugar regulation gets tricky. Here, the family needs to stop offering sugary foods as treats or comfort, and instead actively support the mom's prescribed physical activity. And third, for the risk or the reality of a miscarriage, the family needs to provide immediate transport to care and fiercely protect the mother's privacy. Actually, let's pause for a second on miscarriages, which is the loss of a pregnancy before 20 weeks. The family's role here is deeply emotional. We literally have to maintain a strict no-blame culture in the household. Never, ever use dismissive phrases like, just try again. It is absolutely crucial to acknowledge their grief and offer nothing but absolute, unwavering support. That brings us to Section 4. After pregnancy, an incredibly important period of critical vigilance. We really need to understand the difference between 2 things here. A lot of folks know about the baby blues, those short-term passing emotional changes. But postpartum depression, or PPD, is a completely different beast. PPD is an intense, severe, persistent, and highly disruptive emotional storm. It can bring on massive anxiety and feelings of being totally overwhelmed. Navigating it safely takes a huge amount of family compassion and coordinated teamwork. Because PPD is so serious, the family literally has to step in and rotate caregiving duties. The mom simply cannot do it all alone. Sleep deprivation severely worsens PPD, so someone else has got to handle those night feedings or diaper changes so her brain can actually recover. You have to share the infant care, ask her directly and compassionately how she's doing, and be hypervigilant. If you ever notice urgent warning signs like severe confusion, hallucinations, or thoughts of self-harm, you must get emergency medical help immediately. Remember, this is a true medical emergency, not a character flaw. All right, moving into section 5, the shared family role. Let's get really practical here. Everyone in the house has a specific job. Fathers and partners, you need to share those household tasks and take a really active role in health decisions and emotional support. Older siblings, you can actually help monitor the younger kids' immunization schedules and assist with supervision to lighten the daily load. And teenagers, your job is practicing good hygiene, but even more importantly, knowing that it's safe to communicate openly with your parents if something feels physically or emotionally off with your own health. Finally, section 6, let's do a quick recap and talk next steps. Let's test what we just covered about early pregnancy loss. Is this common myth true? Is a miscarriage the mother's fault? Absolutely false. Blaming a mother for a miscarriage is incredibly harmful and stigmatizing. So many pregnancy losses are completely beyond personal control and happen due to natural causes. Instead of pointing fingers, families have to step up as advocates, providing intense grief support without a single ounce of blame. Okay, here's another big one, especially with all the wellness advice floating around out there. If a mom eats perfectly balanced, nutrient-rich meals, can she just skip going to the clinic for routine prenatal care? No way. False again. Good nutrition is fantastic and absolutely necessary, but you literally cannot replace routine professional screening. It's the absolute only way to catch silent, hidden issues early on, like gestational diabetes or high blood pressure. You just can't diagnose those by feeling good. It's kind of like checking the oil in a car. It might run fine on the outside, but you still need a mechanic to look under the hood. Accurate, professional medical information is your family's best defense. So, if you take away one overriding point from our session today, let it be this. Genuine protection isn't something you scramble to do only after a problem pops up. Protecting mothers and children becomes a truly sustainable reality when these preventive actions are just a standard part of your family's everyday routine, built on communication and constant teamwork. I'm going to leave you with a provocative thought to chew on. Based on everything we've just unpacked together, whether it's being the emotional supporter who listens without judging, or the designated information checker tracking those immunization schedules, how are you going to step up in your family today? Keep learning, keep caring, and let's actually put this knowledge into action.